My name is Jacob Jeseru, and I'm currently a DBA student with Indiana Wesleyan University. And my applied doctoral project is titled Reduce No-Show Rate at JSP Hospital. However, the virtuous business model is God's way of doing business, according to Broker and Boys 2017. In my project, my HDP, I reiterated the significances of the virtuous leadership because it is a bedrock of its sustainable businesses in corporate American. God's view of doing business is captured in stewardship, integrity, honesty, empathy, beyond self-aggrandizement and personal profit. Patient disappointments, as it were, are sometimes a result of unethical decisions, bad business decisions, resulting in high healthcare costs. High insurance premium and co-pays can hinder payees who cannot afford it, making them to miss appointment, and however, causing administrative issues and negatively impacting preventive medicine. GSP has faced an elevated high no-show rate and it's seeking help in minimizing the burden of missed appointment. GSP believe that this issue blocks the timely delivery of care and the best use of their resources. To help GSP combat this issue, the following were examined to identify the primary cause of missed appointment and to develop a real-time solution. In my previous section, I emphasized the need to conduct further research into the current issues that currently plague GSP, which is patient missing appointments. And this section provides a comprehensive roadmap to address no-shows and assess long-term intervention that can be used to reduce missed appointments. However, there is an immediate need for GSP to get a solution. In dealing with this issue, qualitative research methods have been used in the analysis with a consideration of the four frame models to fill in the identified gaps and meet the ethical standards set out by the Institutional Review Board, that's the IRB. The four frame model is one of those developed by Bowman and Deal, and it views issues through four lenses or four perspectives, including structural, human resources, political, and symbolic perspectives. It gives a flexible solution applicable in various settings and helps override prejudice caused by the reliance of one angle or one perspective. To strengthen theoretical analysis, the VBM model was integrated and were the main principles to follow. They are called core principles because why? It is built on good ethical practices. The VBM will also guide GSP on its goal and make sure that they observed the best use of AI by putting integrity and honesty first. However, studies have reported that online ratings of doctors may contribute to patient no-show, but without any additional information to verify this hypothesis, according to Suk et al. 2021. The challenge of patients not attending appointment is complicated and is multidimensional, according to Odkin et al. 2021. The absence of missed appointment, as it will, contributes to longer waiting times and wasted times as well during appointment confirmations and rescheduling. The failure not to show up for appointments can result in ineffective internal scheduling, and at the same time put more pressure on the scheduling team. Sometimes missing appointment can really impact patients' uh, windows of preventive medicine. And getting a solution for GSP is at the forefront to ensure that they meet their goals as far as the patient is concerned, at the same time to meet the goals concerning